Good morning, everyone. Today I joined the Bermuda Police Service partner, the Bermuda Road Safety Council, to once again bring to your attention some alarming data that is being gathered as a result of what can only be described as carnage on our roads. To date, we have recorded 9 road traffic fatalities. In comparison, there were 9 in total in 2013 and 9 in total in 2012. As we still have 5 months left of 2014, the number of road traffic-related fatalities suffered already is of serious concern. In total, there have been 848 collisions on the roads in Bermuda so far in 2014. This includes, in addition to the 9 road traffic fatalities, there have been 80 collisions involving serious injury. These people have been seriously affected with life-changing injury, in some cases that include disability and years of rehabilitation in others. Serious injury is a classification given where a victim has suffered a brain injury, paralysis, broken limbs, and/or admission to the King Edward Memorial Hospital Intensive Care Unit. Driving or riding whilst impaired in a manner that is dangerous or without due care and attention are decision-based. Bad decisions are too frequently being made by road users, and the consequences are very serious. There is an increased disregard for the national speed limit, for traffic signs, red lights, and the requirement to use turn signals. Every road user, whether as a motorist, a bicyclist, or a pedestrian, has a responsibility to obey the law and use the roads in a responsible way. The Bermuda Police Service will continue to enforce traffic laws. Speed detection devices are regularly being deployed island-wide, and numerous motorists are being placed before the courts for speeding offences. The frequency of detecting speeding motorists in the 65 kilometre to 85 kilometre per hour range continues to increase. As we have said before, enforcement alone is not going to reverse the current culture of bad driving behaviour. Raising awareness and having a conversation about driving and riding will.
Good morning, everyone. The numbers that are in front of you that the inspector just read out to you is considered to be a national health crisis for the Road Safety Council. These statistics should be a rally for change in Bermuda. However, we normally focus on the first numbers, the numbers of fatality. We at the Road Safety Council are now focusing and will continue to focus on all the numbers that are in front of you. We have seen accidents that have caused loved ones to suffer. We've seen loved ones go home without the loved ones they left behind at the hospital because some have been paralyzed. And who suffers in Bermuda? Everyone. Your loved ones suffer, your health insurance premiums go up, the motor insurance premiums go up, the damages to our infrastructure, someone has to pay for that, and the list goes on and on. We at the Road Safety Council, along with our partners, the Bermuda Police Service, we consider this a national health crisis, and we are asking for the Bermuda public to help us. The Road Safety Council, over the next few months, will continue to educate the public on road safety. 1, back-to-school events. 2, our Road Safety Week coming up in November the 17th to the 23rd. We'll be giving you more information as the time gets closer. Christmas campaign. And what we're excited about over the last years, our education officer, Mr. David Mine, has been working very hard on the road sobriety checks. We are happy to support the minister as he goes forward, as we are near end of the work that he's been doing. I congratulate Mr. Minus and the team at the TCD for the job well done in getting this ready. But we at the Road Safety Council are urging the public to come on board with the campaign. In 2013, we started a campaign called Think, Choose, and Live. Very simple words, think, choose, and live. We're asking everyone, especially those in those age brackets that we're very concerned about, between the ages of 25 and 35, who are losing their lives, think before you get on your bike and make the right choice. Then, of course, ultimately, you want to live. So we need your help, and today is our request to the Bermuda public to slow down, look twice, drive carefully, and remember, I said this before, the life you might save could be your own. Thank you very much.
The Bermuda Police Service has started to analyze in greater detail the collision data that is collected. This analysis is equally producing alarming facts. In 2012, there were 139 serious injury collisions. In 2013, there were 136 serious injury collisions. And so far, in 2014, there have been 80 serious injury collisions. The largest age bracket represented in the serious injury collisions is the 26 to 35-year-olds. We are calling this the testosterone group. This is also the hardest group to reach and get the message to about road safety. 83% of serious injury collisions involve Bermudians. 81% are male, and 68% were black. Over the 4-day cup match holiday, we told you that there had been a total of 24 collisions resulting in 4 persons being left with serious injury. One of those, unfortunately, later succumbed to his injuries and passed away. In the 11 days since the cup match holiday and up until 8 a.m. this morning, there have been 37 additional collisions on our roads. 19 were damage only, 16 collisions saw 19 persons receive slight injury, and 2 collisions have involved serious injury. The 2 collisions resulting in serious injury saw 3 persons being admitted to the King Edward Memorial Hospital, with 1 later being airlifted to the United States for further treatment. We must work towards improving road safety and reduce the frequency of collisions where lives are lost or where lives are affected and become miserable because of injuries suffered. Saving lives on our roads is paramount. The Bermuda Police Service will continue to work with and support the Bermuda Road Safety Council. All are encouraged to get involved in improving driving behavior by raising awareness of the problem and having a conversation with loved ones and colleagues. Road safety is everyone's safety.
Less of the Bermudian warmth in dealing with this problem. For example, in some countries, in school areas, campuses, they've actually been known to put death crash cars out on display to show the kids that this can happen to them. And yet in Bermuda, that has been suggested, but everyone says, oh, that's going too far. Do you think the time has come when it isn't going too far?
I think that campaign was already run by the Bermuda Road Safety Council. Smashed up cars were put down Crow Lane and in various places to get people's attention.
Protest to it, though, wasn't there?
There was some negative feedback, and I think there was some positive feedback as well. But certainly what it does is it raises awareness, and perhaps it brings home the reality that this is the carnage that is suffered. In collisions in vehicles, in cars in particular, where most people are now wearing seat belts, we still have the odd people that are not. And the cars are equipped with various safety devices, airbags, and et cetera. All of those things are helpful, except when speed is put into the equation and the front of the car is now closing in on the passenger and the driver and crushes them in there. The injuries are horrific.
What exactly is the police going to do differently they haven't done all this time? Because I'll use Saturday night information coming to me, the roads were red, as we know that we're in, that car and sounds like was speeding.
Yep.
What are you going to do to get to these young people?
Yep. Okay. So the commissioner tasked me, and he asked me to have a really fresh look at the problem. What is the problem, and why are we having this problem? We did. We did some considerable research. We reached out to partners. We've been overseas. So the difference now is we have the Bermuda Police Service is a learning organization. We know that enforcement alone is not going to fix the problem. We can hand out 200 speeding tickets a week, and we have done nothing to change the problem on the roads. So we acknowledge that raising awareness is probably the biggest contribution that the Bermuda Police Service can have towards calming the roads, and certainly working in partnership with our partners. That's what we intend to do, and to put a lot of energy into that.
Dr. Crocker.
Yes, sir.
PhD.
Go ahead, Mr. Lindsay.
Dr. Crocker, I'm going to ask you the same question because for the last year I've heard the same campaign. The campaigns are saying, or 3 of the campaigns have been saying, what are we going to do different?
Well,
It's falling on deaf ears. These young people are not listening. These drivers and riders are not listening.
I would respectfully disagree with you. I think there is a portion of our Bermuda community is listening. Then there's a small percentage that's not listening. This is not everyone that's fallen into the same category. We have some very outstanding riders and drivers. I commend our young people that have gone through Project Ride. Statistics show that even over 500 people that's gone through, they've done extremely well. But the age group that we're referring to is the 25 to 35-year-olds. Now, some will say they're not as young as they used to be, so some could be set in their own ways. But we are trying our best to revisit our campaign, and we've got meetings set up to find how do we continue to get the message across to that age group.
I think you say that you're refuting what I'm saying, but you wouldn't be causing a carnage or an emergency meeting if you were making headway.
Well, making headway can be done on two fronts. Headway to me is one, we've seen our young people riding exceptionally well. Some may differ with that, but I'm on the road quite often, and what I see is I'm very pleased with. Then there is that other age group which we're not pleased with. We've had campaigns just recently, very simple, get real about what's going on Bermuda roads. And just this morning, I just give an example, just this morning, coming from Somerset, speed is real. 25 to 35, speed is real. So, we have to understand that campaign that we've been running has been good, but we recognize we've got to revisit and see what is going to be best for that age group. I'm hoping that this right here will be the start of it.
Yeah, and just to further on to that, the other subtle difference in our approach, both the Road Safety Council and the police service, is that we recognize that when there's a road traffic fatality, those incidents get a lot of attention. In the background is the serious collisions involving serious injury that get no attention at all. And I think that we now need to bring the reality that this is going on, that we have wards full of paralyzed people. We have people that are undergoing years of rehabilitation to correct injuries that they're sustained. So that's the difference in the approaches, that we're going to take that on as well and bring that reality and hammer that home to Bermuda.
Yes, sir.
In your initial address, you mentioned sobriety checks, a lot of work being done on that front and the work being close. Can you elaborate on how close?
Well, the minister spoke recently. In the next session, he would like to present something to Parliament. I think if we continue to understand the minister's direction, that's how close it is. The minister is personally making a commitment to the Bermuda public, and we support that. So in the next session of Parliament, we should see it being presented to Parliament. Okay?
Oh yeah, the only question I had was
Sure.
about speed cameras. How close, is it just financial barriers that are holding us back to getting them? Is it something that potentially we could get down the line? It seems to work quite well on the
Yeah, I'm not sure if that's still up for discussion at this time. Speed cameras obviously involve a lot of resources and perhaps some legislation. I'm not sure that we're there yet on that.